Jubi, and we're here at the Chicago Be All, the Midwest's largest transgender conference. And I'm here with Dr. Terrence Murphy, who's doing a seminar at the Be All. Welcome, Dr. Murphy.
Thank you, Jubi.
So can you tell us a little bit about your background?
Well, I'm a plastic surgeon, board-certified plastic surgeon, and I originally am from the East Coast, and I did a lot of my training in Canada, originally from Canada, and I did my plastic surgery training in the Boston area at the Leahy Clinic, which is a multi-specialty clinic on the outskirts of Boston, kind of with a focus on surgery. Once I completed my training, I went back and worked for Canada for a couple of years, and I've been in Denver since 1994. My practice now is entirely cosmetic surgery. And for the last 10 years, I've been doing more and more surgery on transgender patients. Feminization surgery, both facial, breast surgery, body surgery. But the main focus, of course, is facial feminization surgery for transgender patients.
And is that the main focus of your seminar?
It was. I gave a talk, and as I said at the beginning of my talk, when you're speaking with transgender patients, you're speaking with an educated crowd. They've done research. They kind of have a good understanding of the options as far as facial feminization surgery. So I try to give them my approach. When we talk about the procedures I do, we look at some results, pre-op and post-op. I think that cosmetic surgery patients are results-oriented, and if we can show some results that are good, it's nice. And we talk about my philosophy, about how I treat my patients, talk about my office. I have my own surgical suite in Denver, Colorado, and it's very personal. I have a great staff that sees patients both before, during, and after surgery, and it works well.
So what would you say to the Be All attendees about who might be a good candidate or who might not be a good candidate for your surgery?
Whether a patient is a good candidate, of course, takes a number of things into effect. First, are they medically healthy? Most of them are. Do they have the right mindset, and have they given some thought about having surgery? It seems to me that most transgender patients, the first surgeon they see is a facial feminization surgeon. It's important that they have made a firm commitment, obviously, about their gender assignment, because to even take medications, make conscious decisions about how you're going to live is one thing, but to have surgery is another thing. And so I like to make clear with them they've made firm commitment about their transgender decisions. And once we kind of get the health and those kind of decisions underway and that things are good, then you have to make decisions about which operations you're going to do.
And what are some of the options for operations?
Which procedures a patient has are mostly dependent upon their desires. And so we sit and we talk, and I ask them what do they want to see that's changed, what do they want to see changed, what are their goals as far as the surgery. And also it comes into play what my opinion is, obviously, as well, and my kind of somewhat artistic vision about what is going to be the best for the patient to get them where they want to be. So we do a physical exam, we have a look at their facial features, and as we know, there are certain facial features which tend to be more feminine, and we focus on those. I think that a lot of patients who are transgender also have, signs of facial aging as well. And so it's a combination of procedures for facial aging, plus those that are adapted to achieving a more feminine appearance.
Could you speak to the recovery time and maybe some of the other fears the patient might be?
Yeah. Well, obviously there are fears about the anesthetic and the procedure, which are well-proven anesthesia techniques and well-proven procedure, and these are generally very safe. As far as the recovery goes, I tell patients that the recovery from facial surgery is much more related to how you look than how you feel. There is some pain involved and some early post-operative issues as far as perhaps nausea and those kind of recovery things. But within the first day or two they settle down, then you're left with swelling and bruising and just having things mature and settle. The procedures we do for facial feminization are fairly invasive. This sometimes involves bony work if you're recontouring the brow. Nose operations are common, recontouring the jaw. These kind of procedures involve a little bigger incisions sometimes. and more swelling and more bruising than a lot of facial procedures. So we have to work with them beforehand to educate them that what's going to happen, and then work with them afterwards as far as getting through it. But the recovery is kind of a week or 10 days. Swelling's doing better, people are getting around more, getting out doing more. 3 weeks for all the bruising to go away. And by 3 weeks, you're kind of doing a lot better as far as getting around, exercising, and getting back to things.
You also mentioned some body modification. What's your take on that?
Well, there's breast surgery, and most commonly breast augmentation, which is a pretty big field to discuss. We spend time going over size, implant choices, those kind of things. So breast augmentation, and body contouring. Body contouring, of course, is a huge field as well, depending on the history of the patient. If they have had major weight fluctuations, we can do tummy tucks, body lifts, those kind of things. But commonly, it's body contouring in the form of liposuction, removing more male aspects of fat fullness, so taking those out and perhaps re-injecting them into areas to give a more female appearance. The Brazilian butt lift is a common procedure we've heard of, so we can harvest and concentrate some of the fat, augment the buttock, fill in the lateral thigh hollow that tends to not be quite so female. We want to fill that area in to give a more female shape. So taking fat from one place and moving it to another is the most common.
And what attracted you to BL?
Well, over the years, I have steadily increased the transgender aspects of my practice. And then over the last couple of years, I've thought about potentially promoting it more. It started kind of with the Gender Identity Center in Denver and their Gold Rush they have, which was a big event. And then we started to look around other gatherings around the country, and BL is very highly rated and was strongly recommended by a lot of people, and so we're here.
Mm-hmm. And what's your experience with BL so far?
Oh, we had a lot of fun. It was good. First of all, we like Chicago, which is nice. My wife came with me. Chicago's a great city. And we met a lot of nice people and potentially get some business, which is nice. Take care of some people.
So you mentioned facial feminization process, and it's multiple surgeries. So what are the steps involved in that?
Once you've had the consultation and made a decision about the surgical procedures, I think that probably the most important procedure I do on the majority of my patients has to do with rejuvenation around the eye area. When you look at someone, you look at them in their eyes. And so if you can improve the appearance of their eyes and feminize it, not only will the patient feel better about themselves, but people who talk with them perceive them as more female. And that'll be how they'll identify them. So rejuvenation around the eye is definitely the most important, and one of the most common procedures we do is related to the brow. Almost all patients require a degree of elevation of their brow. I like a low medial brow that kind of arches up, and recontouring the underlying bone. Typically it's done through an incision that goes over the top, and the location of that depends upon the hairline of the patient and what we're planning on doing with the hairline as we're finishing up the procedure. So once we get the incision made, we go in and recontour the brow. I do it with kind of a burring technique to take down the bony prominences, which I find very adequate and very effective. And then as we reposition the soft tissues, we will have decided before the procedure the kind of goals we want to meet, and then elevate the brow, potentially advance the hairline. And that certainly is one of the procedures which is the most dramatic, I think, as far as feminizing the face.
Well, so how can people get in touch with you? Do you have a website? Or?
I do. I'm in Denver, Colorado. My information is available on the internet. My website is www.murphyplasticsurgery.com is my main website. And then I also have a website, www.facialfeminization.com. And those are available on the website, and that's where you find me.
Thank you. I really do appreciate the time you've spent with us today, and I hope you enjoy the rest of your time here at BL.
Oh, thank you very much.
Thank you.